So this is the second video I have that talks about blood vessels. The first video I have here on YouTube talks about the overall structure that blood vessels can have and how blood vessels can have up to 3 layers. And these layers are what we call tunics. And the outermost layer is what's called the tunica adventitia. Then we have the tunica media, and then we have the tunica intima. And it also goes on to talk about arteries and how the body believes that arteries are more important than veins. So arteries are the ones that 99% of all the arteries in your body carry nutrients away from the heart. And therefore, our bodies consider arteries to be more important. So arteries tend to be thicker, they tend to be buried down deeper, and blood moves through them a little bit faster. And the other video talked about what we call elastic arteries, muscular arteries, and then these things called arterioles. And it's all based on how many layers they have. And then arterioles become our capillaries. And capillaries are only 1 cell layer thick, and they're made up of what's called the tunica intima. They're made of simple squamous tissue. And so this video is going to look at venules and veins. So when the arteries leave the heart, the arteries that attach to the heart, your aorta and your pulmonary arteries, are the 2 largest, thickest arteries you have. And they contain all 3 layers. The tunica adventitia, which is mostly collagen fibers, the tunica media, which is mostly smooth muscle, which is why they pulse, and then the tunica intima, which is the lining on the inside. And as they leave the heart, they'll begin to branch. And every time they branch, they become a little bit thinner. And so these elastic arteries become what we call muscular or distributing arteries. They still have all 3 layers, but these guys are buried a little bit deeper. So the tunica adventitia, which is on the outside, it's also called the tunic externa, it's getting a little bit thinner. And they'll continue to branch and branch and branch until they only have 2 layers. The tunica adventitia is gone. Well, to be an artery, by definition, you have to have all 3 layers. So at this point in time, these vessels are called arterioles. And your arterioles will continue to branch and branch until the tunica media is gone, and all that's left is the capillary, the tunica intima. So we have capillaries. And capillaries are where gas exchange takes place. Well, then our capillaries are going to start to come back together. And as they merge, they will begin to get thicker and thicker. And it's going to lead us to these things called venules and veins. Okay? Again, to be an artery, you have to have 3 layers. To be a vein, you have to have 3 layers. Well, arteries become arterioles, and the arterioles only have 2 layers, and then they become capillaries with only 1 layer. And then our capillaries will begin to merge until they have 2 layers again. At that point in time, these are what we call venules. Okay? So venules are carrying carrying blood back to the heart. By definition, arteries carry blood away from the heart, and veins bring blood back. Well, 99% of the arteries in your body are carrying oxygenated blood or nutrient-rich blood away from the heart. The pulmonary arteries, however, are carrying deoxygenated blood, but we'll talk more about that in the heart video. So 99% of your veins are bringing deoxygenated blood back to the heart. Well, to be a vein, you have to have 3 layers. We've got to get to those 3 layers. So the capillaries will begin to merge, and as they merge, they become thicker and thicker until eventually we have 2 layers again, and at that point in time, they're called venules. And the venules will continue to merge and merge and merge until you have all 3 layers again. At that point in time, they are what we call your veins. Now, veins, by definition, have all 3 layers. They have a tunica intima, the tunica media, and the tunica adventitia. And most of the veins in our body are blue. Not because the blood is blue, but when carbon dioxide builds up in our body tissue, it turns our body tissues blue. And since 99% of all the veins in your body are carrying deoxygenated blood, the tissues that the veins are made up from will turn blue. It's what we call cyanosis. This is why when you're really cold, your toes, your fingers, your lips turn blue. They are folds, and folds increase surface area. We lose a lot of heat through our lips, our fingers, and our toes. So when we get cold, our body does what's called shunting. It will turn off the blood supply to our fingers, our toes, and our lips. And so therefore, carbon dioxide will build up in that tissue. And therefore, that tissue is going to turn blue. And if you're not getting blood supply to that area, the nerves are going to start to shut down. So that's why your fingers turn numb. Now, because most of our veins are carrying waste products, our body, nature does not consider arteries and veins on the same level. Nature considers arteries to be more important than veins. So arteries are a lot thicker, they're a lot stronger, they're buried deep down, and blood moves through them really fast. In the case of our veins, most of our veins have to go against gravity. If you think about it, most of our veins are coming up from our feet, and blood moves a little bit slower in them. They're not as thick because most of them are carrying deoxygenated or waste products, blood that has a lot of waste products in it. So the layers of the veins aren't as thick as arteries. They don't have to withstand the pressure. They're not very deep. And I always call blood vessels garden hoses. Well, even when the water is turned off, the garden hose still stays around. Well, that would be an example of an artery. Arteries are so thick and they have all these fibers that even if we were to drain our bodies, our arteries would still stay perfectly round like a garden hose. Veins are more like water balloons. As long as something is inside of them, they'll swell up. But they're not as strong, they don't have the collagen fibers, so if we were to drain the blood, our veins would collapse. And like I mentioned, most of our veins do carry deoxygenated blood, so the tunics, which are the layers, are blue. That's what we mean cyanotic. But like I also mentioned, most of the veins are moving against gravity. Most of the veins in your body are coming up from your feet, and so they have to worry about gravity. So our veins have something that our arteries do not have. Every so many small amounts, I don't even know the small amounts, we have basically what looks like a little swinging door. We have a valve, and those valves are there to make sure that blood is constantly moving up. So in the smooth muscle peristalsis, basically that means it pulses. When the vein squeezes shut, that's going to push the doors open and blood gets pushed upward. Then this door closes and it creates little rooms in your veins. And so the blood gets trapped in that little room. It can't fall back down. If we didn't have these valves, all of our blood would be collecting at our feet. Well, we also have valves in the veins coming from our brain. And you're like, okay, well, they don't have to worry about gravity, but we don't want the blood to leave too fast because of gravity pulling it down. So our veins have these little valves in them that when it peristalsis, the valves swing open, so blood gets pushed to the next chamber, then the doors close, then it kind of pushes open, blood gets pushed to the next chamber, so on and so forth. Now, just some information. If you were to put all of your blood vessels end to end, they would stretch to the moon and back. That's a lot of blood vessels, a lot of miles inside of our body, because we need this in order to take all this nutrients and waste products. And the blood inside the blood vessel does not give that blood vessel nutrients. If that were the case, our arteries would take all the nutrients. Our blood vessels have blood vessels. All of our blood vessels also have smaller capillaries wrapping around them. What we're going to look at are problems you can have with blood vessels. And we're going to start off with problems that you can have with arteries. So you're going to notice that these terms start with an A. Please keep in mind, this can happen in any blood vessel. We just only tend to really worry about it when it happens in an artery. We have what's called arterial sclerosis, which is also called hardening of the arteries. This can happen in veins as well. However, veins are more flexible. Veins aren't these hard garden hoses. You guys know the garden hoses can't expand. They don't swell up like a water balloon. So if this occurs, it's more damaging in an artery. Okay? What we're going to talk about can happen in a vein, but since veins are more flexible, it doesn't cause as big of a problem. So usually when we talk about arterial sclerosis, we are just focusing on arteries. And what happens is we begin to get a buildup of surface material. And that's what you're seeing here in these diagrams. In the top left-hand corner, this is what your artery, all of your blood vessels should look like. They should be nice and smooth on the inside. But stuff like plaque or cholesterol can begin to build up, and you start to see that if you go clockwise, and that causes the lumen, and the lumen is the hollow area of the blood vessel, to get smaller and smaller and smaller. So it's like going from a 4-lane road to having an accident, and all of a sudden everybody has to squeeze down into 1 lane. That can cause an increase of pressure behind that blockage. So it would kind of be like you taking a garden hose and squeezing it at one end, but the other side begins to swell. And it can continue to swell and continue to swell and cause that blood vessel to tear. So it does make rough patches. It can cause blood clots to form. And I do have a video on YouTube that talks about white blood cells and platelets and how blood clots form, and what we call good blood clots and what we call bad blood clots. So since we do have this buildup, it's going to increase blood pressure. It's going to make it harder for our heart because, again, it's just like you're going from a 4-lane road all of a sudden to everybody having to squeeze down into 1 lane. Your pressure builds up. Well, this can cause something called an embolus, which is a bad blood clot, where all of a sudden these pieces start to break off and like bullets start to shoot. Or like I mentioned, it's like you taking a water balloon and kind of squeezing one side or squeezing in the middle, and one side starts to swell. Well, we can get an increase of pressure behind or what's in front of that narrowing of the arteries, which can cause that blood vessel to swell and it can cause that blood vessel to tear. And when that happens, it's called an aneurysm. Now, a lot of people think of aneurysms as strokes, and they are not one and the same. They do go hand in hand, but they're not one and the same. By definition, an aneurysm is the ballooning of a blood vessel. Again, this can happen in any blood vessel. It can happen in a capillary. It can happen in a vein. We tend just to really focus on it when it's happening in an artery, because arteries are like garden hoses. They're not meant to swell. You know, veins are more like water balloons. They can swell a little bit. So an aneurysm is what we call the ballooning or the swelling of a vessel. So as you can see in this picture, this is your aorta, your abdominal aorta, and you can see how it's begun to swell. Well, just like a garden hose is not meant to swell up because we need that pressure, this with the aneurysm, this is the ballooning. It's going to start to swell, and that can stretch those collagen fibers. And collagen fibers are incredibly thick fibers that make up the outer layer of blood vessels, and they're not like rubber bands. They're not going to stretch and bounce back. If the collagen fibers stretch, they're going to stay stretched. They're not going to go back to the normal size, which leads to weakening of that layer. And if it does continue to stretch, it can cause that blood vessel to tear. And so, like I mentioned, a lot of times people consider aneurysms and strokes to be the same thing, and that's not necessarily the case. An aneurysm is anytime a blood vessel swells. And again, this can happen in a capillary, it can happen in a vein. We tend to just focus on it when it's happening in arteries. Now, if an aneurysm were to occur in the brain and that pop, that's what a stroke is. Okay? A lot of times it's not considered to be a stroke until the blood vessel tears. And it's just like a balloon popping, it's an explosion. And so depending on where the blood vessel has popped inside the brain, that's why strokes have different effects. So if the blood vessel ruptures in the parietal lobe, the left parietal lobe, you might lose your ability to speak. If the blood vessel ruptures in your occipital lobe, you could lose your sense of sight. So aneurysms and strokes are not the same thing. An aneurysm can lead to a stroke. Speaking of aneurysms, varicose veins are aneurysms. Okay? But again, varicose veins are more like water balloons. They can expand, they can stretch. So usually when you see the term aneurysm, people are going to use that in reference to an artery swelling. And when you see varicose veins, they're going to use that in reference to a vein swelling. So varicose veins are aneurysms. But since veins are more flexible, they have less collagen in them, they can kind of swell up like a balloon. And a lot of times with varicose veins, they don't rupture because they don't have the same stretch, they don't have the same pressure on them, they don't have the same thickness of collagen. And so it tends to happen when the walls around a valve stretches. So for many years, this was seen mainly in females because females had the jobs where they sat at the desk all the time. So it would be like you sitting on water balloons. So one side of the water balloon would start to swell, and that can stretch that vein. Or females had the jobs where they worked in department stores or grocery stores where they're standing on their feet a lot. Well, now this is even more common in men because if you think about a lot of the jobs today, people are sitting at their desk on their computers. Well, it's just like you sitting on water balloons. So it's going to cause the balloon to swell on the part that doesn't have the pressure, and it can lead to varicose veins. You can also have what's called phlebitis, and phlebitis is a bacterial infection of the veins, which is probably, in my mind, one of the worst infections you can have. Because remember, when you have an infection, you have an organ that's being damaged. Well, here we have an infection of the veins. And just like when you have an infection, things start to swell. Well, as you know, when things get infected, they begin to swell. And when your blood vessels swell, they can actually swell shut, which is going to stop the blood flow. And what you're actually seeing here in this picture is a gentleman who had phlebitis, and because of the lack of nutrient flow, it did cause his leg to swell, and it swelled enough that his skin actually split. Just to let you know, from this picture, this person, I believe, his leg had to be amputated. Now, with this one, we're going to talk about blood pressure, which is something you've all had done at the doctor's office, or you've gone to a drugstore or Wally World, Target, and stuck your arm in that little thing to check your blood pressure. But blood pressure is the force with which blood presses on the walls of an artery. And again, arteries are thicker, they're stronger, they have more collagen, they're under more pressure. And this is it's indicative of what's happening in your heart. Now, in the perfect world, or what's perfect blood pressure, is what's called the direct method. And this is where we could actually put a probe inside of the heart, and it tends to be inside the left ventricle because the left ventricle is thicker and it's the one that's doing most of the work, in order to see what your blood pressure is. But that's not something we can do, just sitting in the doctor's office. So we tend to do what's called the indirect method. And the indirect method uses that blood pressure cuff, which is like a sphygmomanometer. And they're looking to see, if you have high blood pressure or low blood pressure. Most people are familiar with, what high blood pressure means. Your heart's having to work harder. You might have clogged arteries that can lead to aneurysms in those arteries swelling. Well, a lot of people don't realize low blood pressure as well. If somebody is in an accident, one of the first things they do is they take their blood pressure and they're like, no, I'm fine. Well, if somebody's just been in an accident, their heart is racing and their adrenaline levels are spiking. And so your heart should really be beating really fast and you should have higher blood pressure. But if the doctor, the paramedic, the EMS realizes, okay, their heart is not beating as fast, or they have a lower than normal blood pressure, that's a pretty good sign that there's internal bleeding. Because if you have internal bleeding, your blood vessel, you're just like leaving a running faucet on. So pressure is going to drop, so the heart's going to slow down because it's not having to beat as much. And again, most of us know, high blood pressure. But like I mentioned, we do have the direct method, which is a lot of times they'll put a catheter in. Sometimes they'll go in through like the femoral artery and kind of weave it up into the aorta, into the left ventricle. But this is a surgical procedure. Most of us have all had blood pressure cuffs. And blood pressure cuffs are what we call sphygmometers, and it's what we call the indirect method. And basically, it's like taking a garden hose and wrapping a clamp around it, and you turn the water hose on. And you take that water hose and you bend the water hose, and you stop the water from flowing through that hose. But water is still going into that hose, you're just not letting water leave that hose. So pressure builds up in that hose. Well, pressure builds up in the blood vessel where you've wrapped the cup around and you basically used air. It's like taking that, you use air and you squeeze that blood vessel closed. And that allows pressure to build up. And then you slowly release the pressure. And when that artery is squeezed, it stops peristalsing. And when you release the pressure enough, it will start to pulse again. And that's the sounds you hear when you're taking somebody's blood pressure. And so the first sound you hear is what we call the systolic number. That represents the heart releasing, that pressure is built up and the heart is at its highest pressure. And then the last sound you hear is the diastole. That represents the ventricle relaxing. So it's done its job and it's taking a break. What's considered normal blood pressure is about 120/80, but it really depends on your body size, males versus females. But what most doctors say is it tends to be within a 40-point range. So 120 minus 80 is 40 points. So it really depends on you. And so there's some excellent videos on YouTube to watch that show you how to take blood pressure if it's not something that you're familiar with. So I strongly suggest that you take a look at those videos.